Hello everyone. Welcome. Thank you for joining us. Welcome to our Focus on Health panel. This panel is going to be delivered by graduating students from the MA Service Design, and it is a part of the London College of Communication Postgraduate Showcase. Um, Please, after this panel discussion, do feel free to go and explore further the MA Service Design collection on health-related services and the projects of our panelists. Before we start, I do have a few house rules to share with you. So this event is recorded and it will be made public on the LCC YouTube channel afterwards, within the next couple of weeks. By attending a live event, guests agree to their contribution being captured and used for this purpose. We encourage you to ask questions into the Q&A all throughout the event, and we will get to them towards the end of the event during the designated Q&A section. Our community guidelines, which we expect all participants in virtual events to abide by, both presenters and attendees, have been posted in the chat. Please do share your thoughts on the showcase, on this event, across all social media that you like, by using hashtag LCC Postgrad Shows and hashtag SD Apocalypse, which is the hashtag that goes with the MA Service Design Show. So I'm going to tell you a little bit about this event and what we're doing, and then shortly after we'll start talking to our panelists. So during what we're expecting from this event is 5 of our graduating students from the MA Service Design, Seth, Ruchika, G, Cassie, and Ariba. They're going to share with us some projects which revolve around health, and they're going to share as well their process and all the challenges they encountered. So it is an interesting event, and it is an important one as well, because health has evidently been at the foreground of many of our conversation in the past year. And we are in the middle of a global health crisis, a pandemic. But what is interesting about these projects is that although many of them do have ties with what is happening at the moment, the pandemic is definitely not the focus. These projects look at health in many forms, and today they will discuss many things such as vaccination, body positivity, periods and menstrual health, the mental health of mothers and expecting women, as well as the mental health of children in rural China. I really do want to thank our panelists for joining us today, and for sharing their work with us. I will, without further ado, start our panel by asking a question to Seth. Seth, can you tell us a little bit about your project, and about the insights that led you to the final service concept that you offer?
Yes, thank you, Marian. My project is about informing young adults vaccination knowledge and support them to get vaccinated. So from my interview, I found many people don't think that some vaccines are necessary, especially young adults. They think they're young, healthy, being complacent about their health, thinking these diseases are not a big deal for them. Another problem is that they don't really understand vaccination. They have misunderstandings, lack of knowledge of vaccination, and don't know what to get and where to get vaccines. So currently, the main promotion of the vaccination is the campaign, and it seems under advertising and not systematic. Young adults are often ignored by it. Besides, vaccine schedules are complex and some are personalized. If they cannot be accessible and clear, it will affect the public. So I created something easy and clear for people to use and made the whole experience systematic.
Thank you. Thank you so much. And yes, indeed, I mean, vaccination is definitely hyper relevant right now. And your project does cross over with a lot that is happening right now as well. Would you be able to tell me a little bit more about the values of your service?
Yes, so my service integrates currently separated part of vaccination and provides a complete vaccination support. There are 2 sides of value. The first is awareness. The website collects authentic and accessible information, so people can get all their questions answered only through this website. What's more, our vaccination campaigns will introduce people to this website, so people won't get confused about too many vaccination campaigns out there. Another side is injection. So the website offers self-check form, which gives users vaccination suggestions and explanation of why they should have the vaccine. So users know what vaccine they should have in a quick and easy way. After that, users can book appointments online or choose pop-in service to get vaccine. Finally, they can get all their questions about side effects answered and access to vaccination record on the website.
Thank you. I really like this idea of centralizing information and everything that is needed to understand and understand vaccination and get vaccinated. So thank you for that. I have a question now for Ruchika. Could you tell me about your service, but what was a problem that you found and how, like the problems that you found and how did you address them in this service?
Thank you for your question, Marian. So for my project, I was working on improving menstrual health for slum dwellers in India. And the insights that I found through my research with doctors, menstruators, and charities was that number one, women don't know what's normal with their bodies, and they often end up suffering in silence. Number two, there's lack of communication about periods, and because of the shame and stigma surrounding it, it gets even more difficult. That brings us to the third point. There's a lack of information and a lot of misinformation, and women don't know when to visit a doctor, and it's usually too late by the time they actually see them. I also found that there are several organizations working towards this problem, but there's a lack of synergy. Through my service, I've attempted to leverage existing government, non-government, and social networks to help women or menstruators to manage their menstrual health. I've designed a somewhat complex collaboration network, and I will try my best to explain it to you in simple terms. So the end users of the service are obviously menstruators living in slums who have little or no knowledge about how to manage their menstrual health. And now you must be wondering, how does the service actually help these women? So this brings me to the service enablers. The service is essentially a training program for social healthcare workers, also known as ASHA. Every slum in India has ASHA workers who are currently appointed by the government to check on expecting mothers, newborns, and elderly. And I thought this would be a good entry point as these women belong to the community and are already in touch with them. Through the program, ASHA workers will be trained to conduct fortnightly workshops to teach women about menstrual health through experiential tools like swatch cards that I've designed as part of my service. So imagine a Pantone swatch card with different colors and shades of vaginal discharge and a brief description about what it signifies. In the next step, women are encouraged to track their periods in the period tracker calendar, which will be provided by the service. All they have to do is take stickers from the back of the calendar and mark simple things like duration of their period, the flow, and the pain. The workshops also provide a safe space for women to discuss their menstrual and reproductive health. Over time, in case a woman notices something unusual about their body, she can inform the ASHA worker who will further guide them either to the primary healthcare clinic or to the nearest hospital, depending on the severity of the issue.
Thank you. Yeah, you've mentioned it. It is quite a complex service, and you are tackling something really important as well. So thank you for that, and thank you for sharing it. You've also mentioned women not understanding what is the norm, but that is also an excellent question within menstrual health in general. Is there a physical norm? So thank you. Can you tell me just a little bit more about how you conducted this research and how did you test during lockdown?
So actually, that's a really interesting question. So accessing women during the lockdown was the most difficult challenge. I mean, it was really challenging. These women are not literate and have little or no access to technology. So I couldn't even reach them online. However, most of them work as unskilled laborers. So I set up an informal network through my domestic help, and I was able to conduct research with her friends. I also mapped out the stakeholders that were closest to these women and began interviewing doctors and charitable organizations working in the same area, like I said. So most of these interviews were online, the ones that I had with doctors and charitable organizations, but I spoke to women in individually or in pairs. And I thought that was really good because in the end, women were comfortable when it was like a small intimate group.
Thank you. And finally, can you tell us a little bit about the skills and mindset shifts that you acquired through this project and through your process?
Yeah, I think the entire journey was full of learning through experiments. but I'd say I've learned some extremely valuable lessons the hard way. Firstly, it's important to maintain cultural sensitivity and to be culturally appropriate. I had to constantly remind myself to set aside my personal biases and beliefs while speaking to women at first. A lot of them believe in taboos and myths, some of which can be extremely shocking, but it's best to not react and to challenge those beliefs directly. Secondly, it's beneficial to not presume that the audience has prior knowledge on a certain topic. During one of my interviews, I presumed that the interviewee would know something as simple as why she menstruates, especially because she had two children, and I thought she would have made that connection. But however, that wasn't the case. I was surprised to find she didn't know. Um, I just apologized and I moved forward. And thirdly, I think I've become quite comfortable with embracing uncertainty, although I'm aware that there are pros and cons to it. But there were so many frustratingly uncertain moments during the entire project. I had no other option but to pivot, adapt, test, fail, and then move on. I think it made me more resilient as a designer.
Thank you. And thank you for sharing that, for being honest about not having done always exactly what you were supposed to. And what is important is that you shared with us a moment where you didn't do the right thing, but you rectified it, you acknowledged it, and you learned from it. So that is also a very important part of your process. And thank you for talking to us about building trust and communication with your users. Because that is one of the most important things when we're talking about designing for others. So thank you for that. I have now a couple questions for G. Would you tell us a little bit about your service and your target group?
Yes, thank you, Maria. Thank you for your question. My project target users is left behind children with potential psychological problems in rural China. So who's left behind children in China? So the group is for sake of survival, many parents in rural China go to big cities to work, hence their kids are left behind or sent to their relatives to take care of. Some of them even live alone in the countryside. So parents lack opportunities to stay with their kids, resulting in less communication, and the parents cannot provide their kids with timely care, mentality, and living life. So the service seniors concentrate on participatory art therapy and provide a full range of help on mental health of left behind children in rural China through different touch points. It's hope that left behind children could open their hearts, actively communicate and establish connection with outside world, creating a society where all left behind children won't left behind in the society. So that's the answer.
Thank you, G. This is a particularly serious project, and also you're talking about a group that is very hardly visible. I'm sure that many of us here and many of the members of our audience weren't necessarily even aware of the existence of that particular group. So thank you for sharing your work with us. I do have another question. What would you say were the motivation for you to work on this project, this very difficult project?
Yeah, this really tough project for me as well. I would like to say Left Behind Children is a special group derived from the process of social transformation in China. At that time, there was a lot of data really shocked me. For example, 61 million children have to stay at home without one or both their parents in China. 10 million kids cannot meet their parents longer than 1 year. 11 million children get a call from parents less than twice a year. And 2.057 million children live alone in the countryside. So the data is really shocked, and I was so surprised that time. And the second reason is that I have been a volunteer teacher in the countryside almost every year since 2015. So I got some experience in this field. So when I remember the time, I decided to carry on the project as my major project. I felt really uneasy at the first time because I was afraid of being sucked in previous works and couldn't get rid of the view of the problem from the thinking of service design. So I was also worried that my participation would disturb these children's peace life. Based on my previous experience, I knew that the hearts of those kids are very fragile. However, many so-called caring people in the society came to the rural areas to bring the hope to these children, but most of them just rushed to leave. I think such behavior was more harmful, more hurtful for those kids. So in the end, I still decided to continue the project because for me, I only have one faith in my heart, that which is I really want to do something is long-term and sustainable for those lovely children. So I decided to carry on the project. I think that's the story behind the project.
Thank you. Yeah, indeed, those numbers are quite frightening. And thank you for, I mean, I appreciate that you saw something and immediately you decided to do something about it. And it's an interesting exercise that you're discussing, that is to partially leave that thinking of service design behind to better actually understand the issue and to do something about it. So really, thank you for sharing your process. I now have a question for Cassie. Sorry, can you tell us about your service and your service users and provider?
Thank you for your question, Marianne. My service is named iConfident Themed Health Event. It is a service provided by educational department in China to the middle and high school to help teenagers to build their body confidence. And during the themed month, the school will hold activities like exhibitions, workshops, and family activities. During these activities, the psychological teacher in school will guide the students to discuss topics like how mass media influence the ideal body shape, how to deal with malicious comments, and how to maintain the relationship with your close friends and your family, and learn to love your body, build self-confidence. Also, the parents is also involved in this service. They will use some communication tools provided by the school to understand their children and give them more support. That's all the details on my service. Thank you.
Thank you, Cassie. Again, body positivity, complex subject in itself, and especially when applied to teenagers. So thank you for sharing your project. Can you still tell us a little bit more about, for example, the value of your service?
Yeah, actually, we all know the discussion related to the body image has been discussed in Western countries for decades, and people realize that the consequence of over-chasing perfect figure can cause mental problems like eating disorder and obsessive behavior on weight loss, weight gain, and even more worse, the depression. However, there is not much research in China on this issue. But does it mean it is not so remarkable in China? From my research, it is negative. The answer is negative. An authentic survey showed that 39% of young people are not satisfied with their body shape and appearance in China. So I think one value of this project is that it's a new trial in this field, and it is also suited to the policy released by the government in China these days, that it is necessary to promote the innovation on teenagers' mental health. And another value I found in this project is that not only my project is beneficial to the development of teenagers currently, but also after decades endeavor from the government and the school, it will have long-term effects on the social cultural environment in China. That's my answer. Thank you, Marianne.
Thank you. Again, not necessarily an easy topic to discuss, but necessary work that you're putting in. I have one more question for you. Again, because that topic that you're discussing is so sensitive and it is very private, can you tell us a little bit about how you build trust with your user and how do you ensure that they have an opportunity to express how they actually feel?
Yeah, indeed, during this pandemic, it's more difficult for us to find users and build trust with them without face-to-face talk. In the beginning, some girls and parents I contact are not reluctant to tell me their true feelings and thoughts. So I want to create a safe space for them to talk more freely. So I abandoned the video talking. I held the workshop for each family one by one instead of a focus group. Also, the family can choose to tell me about their experience by audio or by the every methods they want to use. So, and about build trust with my stakeholders. In the beginning, most of them reject my request to interview politely. So I write a post on the WeChat and put on my thoughts, the background and the interactive workshop material on it and send it to them and some chat group as much as possible. And I received many anonymous remarks on it. And then I contact those who have remarks want to share more with me directly. And when I reflect on this prototyping experience, I realized before we try to build trust with users, we need to let them to have a basic understanding of what I am doing and what question I'm gonna ask, not to send a question directly, so they can put their mental barrier down.
Thank you. Again, this isn't the first time today that we see the importance of building trust with users and how to communicate in a way that feels safe. So thank you for sharing how you chose to do it. Now, Ariba, can you tell us a bit about your service? And I have a feeling it's going to need trust as well. So can you tell us about your service and the main insights that you took away from your research process?
Thank you, Marian, for the question. My service hopes to prevent mental health symptoms such as anxiety and depression at the early stage of pregnancy and first-time mothers by connecting them with mothers who are caring for an infant. So the purpose behind this, that the listening will be prioritized, connections built, and learn from real experiences from both sides. So it's more like a peer-to-peer support. And regarding the question, I initially started doing my research on mental health as a wide open topic, looking into different aspects for a specific focus direction. So perinatal mental health really caught my attention. So I then began to explore, trying to understand why mothers who go through anxiety or depression are not willing to seek help. What are they afraid of? Why are they not opening up and talking about their feeling? So the why throughout the process uncovered 4 main insights. The first one, trust. Mothers felt intimidated by healthcare professionals to then talk about their mental health well-being was overwhelming for some. Second, support. I think that played a really huge role. Women felt there's a lack of support to talk openly about how they felt. Afraid of being judged about the feelings and emotions. Some even expressed that it felt more like a formality to check up on how they were doing instead of building a connection first and then making it a bit easier to share about your experience. Third of all, social interaction. Mothers felt more confident talking to someone about the struggles of of the perinatal journey, who have gone through the journey, or someone who's at the same stage as them, and who can relate to them instead of giving them advice of what to do and what not to do. So mothers also expressed that it felt more connected to someone as their level in terms of the different stages of pregnancy, which will trust and would form a bubble of support for both. And lastly, information. There's a wide range of information out there, and it makes it really difficult to understand what choice to make. Mothers express that it is beneficial to have all that information, but it makes it harder to choose what information you want to take in and where to go to seek help. So it's a bit overwhelming for them.
Thank you. Again, a really necessary subject and to discuss, to explore, and to provide for. So thank you for your work and for all the help that you're trying to put in place. Could you tell us, again, wanting to know a bit more, could you tell us about the key learning that maybe you took from this experience?
That definitely would be trusting the process. So for my project, I decided to go with the double diamond methodology. So while I was a bit familiar with it already, however, I struggled to work around this in the beginning of the project because I had already lots of potential ideas, and sometimes it seemed like I am skipping steps in order to reach those ideas that I had already fixed in my mind. So there was definitely a moment which made me think, that I need to follow the natural process of the double diamond in order to understand what I'm trying to receive from the project and what I'm trying to give back to the project, leading to meaningful decisions and solutions.
Thank you. It is interesting to hear. I mean, the double diamond, for maybe some of our attendees, aren't necessarily close to service design, but the double diamond is a methodology that is commonly used. But it is interesting to hear you talk about it in relationship to an actual project that you carried out. So that's why it's always interesting to hear about process. And as a final question, can you tell us a little bit about the challenges that you encountered?
I think I would kind of relate to Richika as well, as she mentioned earlier, that it was because of COVID-19, it was a really big challenge to find participants as mental health in general. And then talking about, perinatal mental health is quite a really sensitive topic. So for my project, I was looking for first-time mothers and mothers who are caring for an infant, and then who are also willing to talk about the struggles relating to anxiety and worries and depression. So this is because of the stigma around mental health, that it makes, it's hard to talk about and people actually just keep it in. And this, it also relating to this, and it was a really hard challenge then to look for healthcare professionals, because I wanted to know the opinions on from their side as well. So because of COVID-19, the going to GP was not easy, so it was restricted to appointments only. So it was a struggle to find healthcare professionals that I could speak to, and then it was really important for me to test further in the process, to test my ideas and get feedback, and then iterate. So, and then also connect to mothers. So it was kind of a challenge. Another challenge was that building a conversation with participants by creating a safe environment where they would feel comfortable to talk to me. So I did this by conducting the interviews face to face, online where it was necessary, and on the phone if they were comfortable to do it more, rather than group sessions. So the thinking behind this was that each woman's experience of pregnancy and during after giving birth is completely different. I didn't want the participants to feel guilty in any way relating to other participants' experiences. Also, my main aim was to find insights. So I didn't want the insights to be confused or somehow kind of related by others. So that was a kind of a challenge as well.
Thank you for sharing these challenges. I know that they meant things were a little bit harder for you. But yeah, well done for sharing for this project and for sharing it with us today. I appreciate that you did share similar challenges as Ruchika, but you talked to us about, you know, again, this idea of safety, of trust, of empathy, and those were overarching kind of themes that we discussed today. So thank you all for sharing your projects. Again, I think there's a few things that really kind of link all your projects together beyond, I think mostly that health might be a private thing, and that sometimes it is a limitation in itself. And you've all provided and designed wonderful services that are just there to help inform people and help genuinely just help people. So thank you for that. We're now going to go on to the Q&A section of this event. I already have a question for Seth. Seth, could you tell us, so what do you consider the best opportunity to capture your potential audience to onboard your service?
Okay, thank you. So my service have multiple channels to attract target audience, and it can be students when they register on the university, the advertisement in transportation sports, and embedding in school PSHE scheme. And I think every way had their own advantages. But I think the social media is a good opportunity to capture potential audience, because young adults, they spend a lot of time on it, and online is full of fake information, and it can directly link users to this website. But I think the most interesting part about social media is it's very easy to open a conversation. You can see, like, every time some advertisement about vaccination on social media, they will all have some negative comments below. And after this project, I was thinking it's more acceptable to see these negative voice instead of just heard when I grow up, like vaccination is all good. It's kind of way to tell people nothing's perfect. Vaccination has its just some points. It's not perfect, but it's more like to intrigue people to think what's the pros, the cons, and to kind of see it in an objective way, and then make their own choices to kind of instead of blindly accept it, but to have a more view of this vaccination thing. Yeah.
Thank you. This wasn't necessarily an easy question, so thank you for answering it. We have another question. It's not addressed to anyone in particular, so anyone who wants to take it, go for it. How has your definition of healthcare changed from the beginning stages of your projects to now, and what surprised you along the way? That is a very good question.
I'm sorry, could you please repeat?
So from the beginning stages of your project, so when you started, didn't have all the knowledge that you have today, have you noticed that your definition of healthcare in general, how has it changed, if it changed, and is there something in particular that surprised you?
I could start and then like the others can join in. So I did know that especially menstruation in India is really stigmatized and people don't speak about it. But as I started researching and finding, like speaking to more people, I realized that there are more people than just women that go through menstruation. So there are transgenders and non-binary people, and they are even more hidden than women. So I know this is not very positive, but I realized that the healthcare system is really not tackling all of these hidden groups, and that makes it even more challenging. There are a lot of charities and even government initiatives that are currently talking about menstrual health, but they're just bombarding information onto these groups that are already sensitive, and they're constantly telling them, okay, come up and speak, but then it's not that easy. So these women may not have the support, they may not have the voice, or they may not even know what to say. So I think it's important to create that safe space, and that's the most important learning, and that's what I attempted to do with my service.
Thank you. Yeah, I like noticing that big institutions and healthcare in many places might not be dealing or tackling issues that concern less visible groups. I mean, that's nothing new, but it's also important to keep it in mind and to continue doing work around it. Anyone else want to jump in, or would you like to go for another question? Oh, yeah.
In the past, when I do the research without the true communication with the stakeholder, I used to think that the psychological education in China is not so well developed. But when I contacted with a school manager, and she told us that in big city in China, there already has some psychological center in school inside, and every class are equipped with a psychological teacher, and they even have a psychological director in the school. So I used to think that people are not make actions. The government haven't make actions on this project on this part, but when I done some deep research and go to the field research, go to the school, I realized that my service can be based on the current academic infrastructures. Yeah, that's my finding.
Thank you. It's important to acknowledge, to acknowledge these challenges, and obviously, so yeah, thank you so much. Another question. Well, actually, it starts with a nice comment. So one of the attendees is thanking you all for introducing your projects and sharing your experiences. So yeah, and saying that moving on with your research despite the pandemic month must have been quite a challenge. That's an understatement. And he's congratulating you. So to all the panelists, what would be the challenges you would like to, the changes, sorry, so used to say challenges, what would be the changes you would like to see in the healthcare sector in general, or in the health services that you worked on?
I'll start with it. That definitely will be clarity of information, because there is so much information out there, and that sometimes confuses us. What is right and what is wrong. It is all trustworthy. However, it makes us question so many different questions. Is it really necessary? How is it helpful? Does that even work? Because there's so many different, the same information, but visualized or said in different ways. So maybe more clarity information would be more would be nice, different to see in healthcare professionals. Especially if you go to GP, when you walk in, there's a board with so many different leaflets. And sometimes if you kind of look closely, there's so much similarities. However, it is portrayed in different ways. So
thank you. That's quite a good observation. Anyone else want to talk? Oh, Seth, go for it.
So I think after doing the healthcare project, I think there are two main things in healthcare: is awareness and convenience. So after doing this project, I think the communication nowadays is not enough. For example, like the COVID vaccine, we can all get it's what the government says is good, it can help others. And there's not really much about the side effects communicate. And I mean, like why have side effects, or why these things happen. It's not very direct. So I was thinking that public don't get like really objective view of this. So it's kind of like they take the effective of vaccination for granted. Like they don't really communicate how it maybe it has side effects, but compared to the pros and cons, it's actually better to have it. It's kind of to give the public more information. So so I think, because the people I contact, they have concerns. It's very normal, but they just don't know like how their question can be answered.
Thank you. It's interesting. It's not the first time you mention subjectivity and objectivity today, and it must have been working around vaccination and information. That must have been quite a challenge for you to work through. So thank you, and well done. I have a question for G. So it is great, really, that you had the experience volunteering in that setting before you did your project. Do you think that this shaped how you approached the subject proposal before you went on the field? And did it help? Did it help, like, not having particular assumptions?
Thank you, Maria. Thanks for your question. I think actually it did. The first, it made me to choose the chose the topic to continue the topic, because my previous experience, I saw the reality, I saw the real situation there. So I know it need to be changed. So it makes me continue the project. That's the really important reason, for one reason. And then another thing is I'm a volunteer teacher there as a art volunteer teacher. So we together did a lot of amazing artwork together. And I think rather than the normal course like math, English course, art can actually, how to say, like work together with children and communicate with them better, because through the whole process, you can easily open their hearts and you can go through the color, shape, lines, and you can easily understand what the different and what each element means. So it really also inspired me to continue the work. So I chose to do the participatory art therapy, this field. It really makes sense for me. And I think another thing is, in my service, I did instruction mailers for each different participatory activities. So I conducted all my previous workshops together and made the guidance for more people to use it. So it's also a good transfer, I think. So that's the answer. Thank you.
Thank you. I really, I can hear what you're saying about how you used art to help these children open up. Again, I advise all our attendees to go and visit all of our panelists' projects, because you'll see the colors and the stimulating shapes of G's cards, but you also see the rest of the projects today, and they all need to be discovered in more depth. So I have a question, quite an interesting question for Mariba, who's definitely coming from an insider. You're from a graphic design background. So it is interesting that the double diamond helped you to hold off on your natural instincts that would be to jump to a solution. So how would you say your final outcome was different from from what you first thought you were going to design?
So the initial ideas were, through the discovery process, I realized the importance of prioritizing listening and communication, to be listened. So it was already, so I knew that in the service will be around, the focus will be around that. So however, I had the ideas of, maybe a app for a communication platform. So, but then when I decided to, focus on the natural process of the double diamond instead of straight trying to reach those ideas, I was really surprised towards the end that the ideas that I had already, they're linking to the final solution. So there was not much of a difference, but I just need to understand what the kind of the process of it, and understanding and kind of defining every stage. So that helped. So the solution was not really different, but it's just the way coming already with ideas, and then this is how it worked.
Thank you. It's almost like the person who asked this question saw your process. How weird. Thank you. We have an interesting question from Issa Brooks, who's one of the current first years. So a few of your projects, and it is addressed to all panelists, a few of your projects are digitally focused. What role do you think technology will play in the future of health? Or what role should technology play in the future of health?
I think is the convenience part. So many things are digitalized, and with this, many things can be very easy to solve. I think something need to be concerned is the privacy, and like how people deal with this information is a big challenge. For example, like so many fake news on the internet. And people are also very easy to access to them. So yeah.
Thank you. Anyone else about technology and the future of health?
I think from my area, the mental health therapy, I think the way will be more multiple. You can not just go to the face-to-face talk with your psychologist therapist. There will be more from like the panic come, you can talk with them by the telephone, and we create more online, like the therapist for you to keep your mental health. And with more high technology like the AI or the AR, yeah, the real reality, I think there will be more interesting and fascinating way for the patients to be cured.
Thank you. It is interesting. In our health collection, we do have a project surrounding telehealth in particular, and that's something that we saw quite a lot of in the past year. So yes, do feel free to go and explore the collection if you want to discover that angle in particular. I have again another tough question, so just brace yourself. So again, which comment starts with a nice comment. Amazing projects, all of you. Thank you for sharing. And the question addressed to all panelists as well. Were there any moments where you had to consciously put any personal judgments aside when engaging with participants, and how did you overcome that? I think Ruchika, you touched a little bit on that earlier, but yes, if any one of you, Ruchika included.
Should I go ahead then? I mean, I'll just add some more and then. So yes, there was definitely personal bias and your own. It's really important to set aside that belief, because it's a very right question, because what happens is that your personal biases and beliefs can really skew the way you're conducting research and approaching people. So the only thing that I had to do was to constantly remind myself. And there's no getting away from it, because the moment you see your bias creep in, you see the person's face change. Yeah, their expression changes basically. So I think, yeah, and then you just have to apologize and move forward. I think that's all I have to add.
No, thank you. I'm reiterating that I love this about your openness to share your process, and saying it's okay to make mistakes and just apologize. We're human, and so are the users. So it's just, saying, oh, I didn't say the right thing. I am sorry. Can we carry on? G, you had something to add, I think.
Yes, I think in my case, I did a field research in the rural areas. At first, I thought like left behind children are sensitive, and because of lacking opportunity to stay with their parents, so their heart was very fragile, and I'm really afraid of to talking with them at the first stage. But then I realized actually they are quite pure, and they are quite most of them are very happy actually. So that's I think this is the misunderstanding at first. And another thing is when I face a child and he is quite shy, I can't talk to them, use very direct questions. I change another way, like you asking gentle, soft questions rather than a really hard one, but I still can know something from the soft question. So I think that's maybe the one solution for when you face the some challenging to talk with people, rather than really direct. You can choose some another way to ask. Yeah, that's my answer. Thank you.
Thank you. I think I didn't necessarily address it before, but you had the added challenge that you were working with children. So that's, for anyone who's worked with children or for children, it is tough. So really, really well done on navigating those challenges and coming out with a really cohesive project. I have, okay, so I have another question for Seth. There seems to be a problem communicating the value of vaccination on a community level, as opposed to the value to the individual. Do you think that the pandemic, do you think that the pandemic has made this better or worse?
Sorry, could you repeat the question again?
Yeah, sorry. I'm going to be honest. Sylvia asked that question, so she's a tough one. So it is. There is a problem. So you addressed especially young adults in your project, and what she's asking is that there might be a problem with communicating the value of vaccination to communities, as opposed to the value of vaccination to an individual. So do you think that the pandemic and the fact that there is a lot of discussion around vaccines, do you think that this pandemic has made this kind of divide in communication worse or better?
Actually, when I interviewed some young adults about the COVID vaccine before the vaccine came out, they said they will get it because they don't worry about themselves, but they do it for others. But I also have some people, they said they won't get vaccine just because for others. So I think it's just people's awareness and they're thinking about the community. So some people, they were thinking they would do things for the community, like for the old people, for vulnerable groups. And some, they maybe don't have the awareness or they don't know it's valuable or how important it is to helping others. Yeah.
Thank you. Sylvia is apologizing for the for the difficult question. So at least there's that. I have a question for Ruchika. Could you share one co-design activity which that you got quite important insight from, or the most important insights from? I think we can open up that question to others afterwards.
So for me, I wasn't able to co-design very, like I was able to create activities. It was more of questions and, testing a few things out. And but one thing that I tried was the calendar. I just printed out a sheet of like 1 month, and I got women to mark the dates of their flow and how much flow they had. And I just asked them simple questions like, was it a lot of, like, did you bleed a lot that day, or was it little? And so they very naturally drew like larger circles on days that they had more bleeding. And another thing that they did was I showed them like a human figure and I asked them to mark the places where they felt pain. So they did the same. They took stickers and they marked like the places where they felt pain. So that's something that really helped, because I figured that women, when you're probing them the right way or you're asking them these questions, they know the answers and they just need a place to put these answers together and to actually make sense out of it, which is why I thought that like a period tracker is really important for them. And so, yeah, that's one of my most interesting co-design or like prototype testing sessions.
Thank you, Rishi. Does anyone want to talk about co-design sessions? You don't have to.
Yes, I would like to share one co-design workshop with children. In my field research, I found there are a lot of abandoned plastic bottles in the countryside. So I found this and I realized that we can use those bottles to do some interesting artwork, and through the process we can teach children and communicate with them better, because usually you ask questions, they can't give you the answer is from their heart. The really one you can't get them just from the question. So I did the workshop with them, and the workshop with them, I created a lot of relaxing atmosphere, and I bring some candy, I bring some color cards to do the transfer activity using the abandoned plastic bottles. So the final works is really amazing, and children love it, and they share their work with each other, and they tell the story how they did it and how they feel it, and they also learn something from the process, because they know they need to protect the environment, and they shouldn't waste the water, especially when they are living in the countryside. They shouldn't waste. So this is really interesting co-design, and I got some really important insights from that as well. That's my experience.
Thank you. It's interesting to see how you did it, and obviously I know that you just admitted that you've bribed your users with sweets, so thank you for that. Okay, so we're gonna run out of time. I do have one last question, and then I can thank you all. We talked a lot about today. We talked about the privacy of health. We talked about trust and empathy. We've talked about values. So I have one general question, and whomever wants to answer, have a go at giving us a quick answer. What would you say is the value that service design can bring to the health sector in general? Don't fight for it. Seth?
I think service design can really find the problem or find the point, because normally the healthcare is very complex, actually. So the service design can, when you engage with the service design, it can solve it's kind of like complex problem to define the problem, and then using a kind of creative way to solve it.
I would actually like to add a small thing onto that. So I like through the project, I realized that there is so much to do even with education and awareness. And instead of everybody working in silos, I think it's really important to bring all of these collaborators together. And I think service design can help with that.
I think service design can, how to say, give you a clear overall picture of the problem, because service design has a lot of different methodologies, and you can break up the big problem into different pieces, and you can see how the problem connect to each other, and you can see the thinking way how you from the problem to the design space. So I think that's the service design power. That's my answer.
Thank you. Oh yeah, Cassie, go for it.
Yeah, I think the service designer has the power to tackle the problem from a more systematic way. For example, the doctor sees the problem for the medical angle, and the patients see the things from their personal pains or something. And the service designer can connect every sector together to find a best solution, to use the to to find a best solution that will go to the to tackle the problem best. Yeah.
One as well.
Yeah, Ariba, you must have a go.
So I believe that service design, it helps you to connect with stakeholders. Connecting to stakeholders gives you an opportunity to work together to identify problems, and then you work together, test them to solve that problem and have many different solutions. So instead of having one solution, it gives you many different directions, and then you test them and you can identify what works well and what doesn't, and you can continue working on it. It does give you an opportunity.
Thank you. So many really good answers, different angles, but all absolutely valid and true. So thank you. We're gonna close this event now soon. In about an hour at 12, we have our meet and greet the graduates, where you're going to have an opportunity to actually talk to them individually on Whereby links. So thank you all for coming. Thank you, the audience, for joining us today, except one person. Thank you to our panelists for talking and sharing these projects. All of them are very, very tough projects, difficult and complex issues that you're tackling there. So thank you for being so cohesive and so great in phrasing your challenges and process. So yes, thank you all. Thank you to the AV team and to Musa, who's our cheerleader. So thank you, everyone, and thank you, Sylvia, for the very difficult question. So yes, you are now dismissed. You may leave, and yes, we're gonna stop this event anytime soon. Thank you again, everyone.